Assalamualaikum warahmatullahi wabarakatuh. Before we go through other subs, it is important for us to know about ergonomics. So, what is actually ergonomics? Ergonomics, in a simple words, is a scientific discipline concerned with the understanding of interactions among humans and other elements of a system. Ergonomics contains of three domains, which is physical, cognitive, and also organizational. Next, we will take a look at several key points in terms of ergonomics guideline, which will help us to understand more about this topic. The first one is ergonomics risk factor, which is any attribute, characteristic, or exposure that may contribute to a musculoskeletal injury. Second is awkward posture, which also known as position of the body while performing work activities that deviate significantly from the natural position. Third is forceful and sustained exertion, which means use of high level force while transporting or supporting load. The fourth one is repetitive motion, known as repeated movement of the same group of joint and muscle too frequent, too quickly, and over a long duration. Next, the fifth term is ergonomist, also known as a professional who contribute to the design and evaluation in order to make it compatible with the needs. The sixth one is occupational health doctor, OHD, which is known as registered medical practitioner with valid annual practicing certificate, APC. The seventh one is low back work related musculoskeletal disorder, which is work related MSTS after the bones, muscle, ligaments, and tendons of the lumbar spine associated with physical work. The eighth one is the non-specific work-related lower limb musculoskeletal disorder, which is the type of disorder that has less well-defined symptom, which is spread over many areas such as nerves, tendon, and other anatomical structure. For the final slide for the regulation one, we'll dive more on the terms of ergonomics. For example, physical ergonomics, where it comprises of dealing with the anatomy, anthropometry, physiology, and biomechanics characteristic. Next is trained person, which is someone who has undergone ergonomics risk assessment training and is able to conduct the assessment. Next is work-related musculoskeletal disorder, which may affect human musculoskeletal system. Next is work-related lower limb musculoskeletal disorder, which affect the hips, knees, and legs due to the overuse of muscles and activities. Lastly is work-related upper limb musculoskeletal disorder, which can affect any region of the neck, shoulders, arms, forearms, wrists, and also hand.
Now, we move to the sub-2, which is planning and conducting an ergonomic risk assessment. An ergonomic risk assessment is a crucial process for identifying and evaluating potential hazards in the workplace. By proactively addressing these hazards, we can prevent injuries, improve employee well-being, and boost productivity. There are two approaches for initiating error. The first approach is proactive approach, which include A, B, and C. A. Employee who has previously attended ergonomic awareness training can report to management, safety, and health committee on any work-related complaint due to the ergonomic risk factor using self-assessment. B. Walk-through inspection by the trained person. And C. Review for records. A trained person can initiate error based on the general risk assessment. An initial error is required if there is a pain or discomfort or probably risk based on the professional judgment of the trained person. If those two conditions is not occur, the initial error is not required. Reactive approach is the second approach. It includes T and E. T is ergonomics related injury and MSTS complaint. After trained person has received complaint related to MSTS from employees, initial error should be initiated. It should be in a formal complaint related to ergonomic disorders and conviction that the problem arises from the ergonomic risk factor. We can refer in Appendix 2. For D, it is requested by OHD or relevant authorities, such as DOSH and SOPCO. Initial error is required for both T and E without the need to access claim of ergonomic risk. Besides, it's the flow and the summary for initiating error. By referring this, it can help you understand more regarding the two approaches, which are proactive and reactive approach. There are two levels of error. Level 1 is initial error, which will be further explained in sub 3. Level 2 is advanced error, which will be further explained in sub 4. In addition, the trained person should start the assessment using an initial error. Then, the outcome will determine if there is a need to carry out an advanced error. Next, to prepare for an assessment, it requires consideration. First one is team formation. Second, instrument materials and facilities. Third, communication and coordination before conducting management, supervisor, employee consent, and any related parties. First, for the team formation, teamwork and good coordination is needed during the implementation of error. It also needs to be led by a responsible person to ensure the assessment is smooth. Second, instrument materials and facilities. It can be referred in the table. Third, communication and coordination before conducting management. Supervisor, employee consent, and any related parties be informed on the objective assessment, work unit to be assessed, error tools to be used, and in the duration of assessment. For the implementation of ERA, there are 3 steps. The first one is aligned with objective of ERA, including determination of risk level, assessment for claim composition, improvement of work unit, and required by the organization. Second, communicate and coordinate with the person in charge by concerning employee to be assessed, arranging time for those assessments, and retrieval of documents such as accident, injuries report, and critical incident. If the document is unavailable, the retrieval should be done after assessment. And third, conduct inspection by trained person to obtain information regarding to work posture, work activities, work environment, existing ergonomics control measures. Next, duration of assessment should be considered by trained person. First, objectives of the assessment. Second, number of employees. And third, complexity of work process. This will affect the duration of assessment. For the closure of assessment, it should be conducted after each assessment includes a summary of assessment without telling the findings and recommendations to allow further analysis of the result.
Next is subtopic 3, which is process for initial error. Firstly is musculoskeletal assessment. This assessment should be conducted for all types of risk factors to identify and validate the affected body parts. The trained person may investigate any other complaint from the employee concerned. The trained person may be used any available forms, for example, Nordic musculoskeletal questionnaire, Dutch musculoskeletal questionnaire, and Cornell musculoskeletal questionnaire. Next is the ergonomic risk factors assessment. It depends on the types of ergonomic risk factors identified. The exposure duration of each work posture may differ depends on the professional judgment of the trained person. Next is awkward posture. So these are the examples of body parts that involve in awkward posture. Firstly, shoulder, second, head, back, hand, and lastly, leg or knees. Meanwhile, for the static and sustained work posture, it involves trunk, head, neck, arm, and wrist. For the other part it involves leg and knees. Next, for forceful exertion, information should be included firstly gender, height of hand, carrying distance, lifting or lowering distance, frequency of forceful exertion, obstruction along the pathway, lighting, vibration, and lastly is physiological and psychological requirement. Next, for lifting and lowering, the figure shows the recommended weight for both gender with different height, which are shoulder height, elbow height, knuckle height, and lastly is the mid-lower leg height. Next is the repetitive lifting and lowering. So the table given is the recommended weight limit for lifting or lowering with repetitive operation, and next is the lifting and lowering with twisted body posture. The table below shows the recommended weight limit for lifting and lowering with twisted body posture. Then for pushing and pulling, when force is applied with hands should be between the knuckle and shoulder height. Distance for pushing or pulling must be less than 20 meters. Wheel is supported on wheels. Pulling or pushing using a well-maintained handling aid, which is the wheels, are properly aligned and in a good condition. So the table given is the recommended puller weight based on the type of activity for pushing or pulling. Next is the handling in seat position. Handling in seat position should be done when the load beyond the recommended weight limit for male or female, and the load is beyond the box as indicated as below. So the figure below shows the recommended weight for seat position.
Another assessment that we need to do is involve carrying. There are 4 factors that we need to consider involve carrying activity. First is floor surface. If the floor is dry, clean and in good condition, we consider it as acceptable. But if the floor is dry but uneven, or if the floor is wet, sloppy and unstable, we need to conduct ERA. The second factor would be environmental factors. If there is no factor present, we consider it as acceptable. But if there is factors such as poor lighting, we need to conduct advanced ERA. The third factor would be carry distance. If the carry distance is between 2 to 10 meter, it is considered acceptable. But if it is more than 10 meter, we need to conduct advanced ERA. The fourth factor would be obstacles in route. If there is no other obstacles, we consider it as acceptable. But if there is obstacles such as trip hazards or the workers using ladder, we need to conduct advanced ERA. The next assessment is single manual handling activity. There are 7 types of single manual activity that we need to check whether it exceeds limit or not. First would be lifting and lowering only. Second, repetitive lifting and lowering. Third, twisted body posture while lifting and lowering. Fourth, repetitive lifting and lowering with twisted body posture. Fifth, pushing and pulling. Sixth, handling in seated position. And the next assessment that we should done is on repetitive motion. We need to check the body part and see whether there is any other risk factor. For the type of work involving repetitive sequence of movement more than twice per minute, or work involving intensive use of fingers, hands or wrists, or work involving intensive data entry, or work involving repetitive shoulder or arm movement with some pauses or continuous shoulder or arm movement, it should not exceed more than 3 hours on normal workday, or more than 1 hour continuously without a break. If it is, we need to tick on it on the assessment. If the work also involves using the heel or base of palm as a hammer more than once per minute, or work using the knee as a hammer more than once per minute, and the work is done more than 2 hours per day, we also need to tick on the repetitive motion assessment. There is also an assessment on hands, arm and whole body vibration. For hand-arm vibration, the physical risk factor would be work using power tools, i.e. battery powered or electrical, pneumatic or hydraulic without PPE. The maximum exposure duration would be not more than 50 minutes in an hour, or not more than 5 hours in 8 hours shift work. For the whole body vibration, the risk factor is work involving exposure to whole body vibration. It should not exceed more than 5 hours in 8 hours shift work, and if there is a complaint about excessive body shaking, the work must not be done more than 3 hours in 8 hours shift of work. There is also environmental risk factors such as lighting. We need to see if there is an inadequate lighting or not and check whether the lighting is sufficient. The next environmental risk factor would be extreme temperature. We need to make sure whether the extreme temperature is manageable. If it is too hot or too cold, we need to tick on the assessment. Another environmental risk factor would be ventilation. If there is inadequate air ventilation, we need to check and tick if the ventilation is inadequate. And the next environmental risk factor would be the noise. If the noise exposure is above permissible exposure limit, PAL, we need to tick on the assessment and check whether the exposed is annoying or excessive noise during working hours. We also need to tick if it is so. So from all the risk factors, we can put all the tick marks on the initial ERA form. The minimum requirement for advanced assessment would be 1 tick mark from each of the risk factors, except for risk factor awkward posture. We need to at least exceed 6 marks. So from initial ERA form, we can make sure whether the advanced ERA is needed or not.
Subtopic 4, Process 4 and Advanced ERA. Step 1, Review initial ERA and adequacy of existing control measure. Step 2, Gather additional information. Step 3, Assess ergonomic risk level or assess workstation configuration. Step 4, Summarize ERA. And last step, Step 5, Set priority for ergonomic improvement. For step 1, review of initial ERA and adequacy of control measure, it is to identify the control measure and assess if existing control measure are adequate or not. This information should be included in advanced ERA report. If additional information required, go to step 2. If not, proceed to step 3. In step 2, which is gathering of an additional information, in this step, a trained person can add more information than needed in advanced ERA. For example, in this appendix 4, it provided form by capturing essential demographic info such as name, gender, and non-occupational details. Next step, step 3A, ergonomic risk level assessment. In this table, it shows the example of method for assessing ergonomic risk factor. This should be determined by qualified individual to choose the suitable method for each risk factor. For step 3B, which is workstation configuration assessment, enhancement of workstation should prioritize the correlation between the employee, task, and physical workspace arrangement. The trained individual also should seek the guidance from the outcome of an advanced ERA with an expert. Step 4, summarize the findings. These two tables show the examples of advanced ERA for lifting operation and office workstation. For last step, step 5, priority for ergonomic improvement using priority setting table. As for an example, the table shows the color which indicate priority level. Example for red shows high, yellow for medium, and green for low.
Assalamualaikum warahmatullahi wabarakatuh. Next, we will go through our fifth sub, which is hierarchy of control based on ergonomics approach. The first step in the hierarchy, which we need to focusing on, is elimination, which also means to remove the unnecessary process, tools, or machine, or substance from workplace. Next is the substitution, which also known as replacing tools or equipments in the mitigation of risk of ergonomics. For the next slide, we can see the two other steps in the hierarchy, which is isolation, also used to separate the hazard from the employers or operator. While the second point is engineering control, which is the modification of physical types of job, workstation, or workplace. For the final point is administrative control, which function to mitigating ergonomics risk factor which control of the higher hierarchy is not feasible. For example, policy, awareness, physical exercise program, and etc.
Let's proceed to the subset regarding assessment report. As you know, all our activities, informations, and outcomes should be finalized and documented. It must be presented to the management of the organization and kept as record. The content for initial era and advanced era must include some information. Both contain some difference. It can be seen in the table beside to help you see the difference.
Moving on to the subtopic 7, which is review of assessment. So, when is the ergonomic risk assessment needs to be reviewed? Firstly, when there has been a significant change in the work to which the assessment relates. A significant change in the work means that the risk situation has changed such as due to, firstly, change of an employee at a designated work area. Second, changes in methods or rate of work or rate or work process. Lastly, is deterioration in the efficiency of control measures. Besides, when there are symptoms or complaints of ergonomic-related injuries or musculoskeletal disorders. And lastly, when directed by the Director General, Deputy Director General, or the Director of Occupational Safety and Health. The content of review error report must include name and address of workplace, description of new work tasks and new activities in each work unit, occupational history and medical history of the employees involved, description of the method used for the assessment of ergonomic risk factors, previous risk evaluation, and conclusion of the assessment of the new risk and new activities in each work unit, and recommendation for further action ergonomic improvement. Lastly, the name of the trained person conducted the assessment and relevant certificate of training attended. Subtopic 8. Responsibility and accountability. Responsibility and accountability describe the trained individual who did the error must guarantee that the findings are properly communicated to the employee or his agent. The employee is responsible for ensuring that effective and timely control measures are implemented in response to the hazard and for communicating the result to the affected employees.
For subtopic 9, instruction, training, and consultation. For instruction, employees should follow all instruction given by employer with respect to the work task, process of activities as recommended by the assessment report. For training, awareness and education training should be conducted for the employees at work, trained person, and management. It also consists two which are employees and trained person. For trained person, it is necessary to attend training for conducting initial ERA and advanced ERA. For consultation, consulting directly with employees is more accurate and effective in reduce the last subtopic, which is subtopic 10, record keeping. These include self-assessment form, complaint record or related medical records, walkthrough inspection and initial findings, investigation report, assessment report, corrective action report, and training records. So, ERA report should be kept in print or electronic format. And then record should be kept for not less than 5 years, except assessment and investigation report should be kept not less than 30 years. So that's all from us. Thank you.